my husband. He's agreed to be my model today to discuss spine lines and wrinkles and static and animated lines. So Tom has some signs of ageing. He's over the age of 30, therefore some signs of ageing are to be expected. As a history, he hasn't worn sun cream every day, summer and winter, until recently, since I got into the industry myself. I think you'll agree to that. So some of the ageing, 80% of his ageing, will be due to the sun exposure. So he would wear it on a hot day, which is the answer most of my clients say to me, but if it's not hot, they wouldn't wear it. Next topic we're going to talk about is static and animated lines. So can you do a really big smile for me? So here's lines on movements, they're animated lines. Can you raise your brows? Lines on movement. Frown. So you can see lines of movement, but if you relax, he doesn't really have many static lines in that area. I would say he has more static lines around his eyes and on his forehead. So static lines are as a result of the movement from the muscle pulling on the skin, creating these static lines. So if you move your forehead again up and then relax, you can see all of the residue lines are where he has movement. Treatment options for animated and static lines. So for animated lines, the option really is a muscle relaxant. Muscle relaxant is not going to wipe out all of your movement entirely. When I perform it, you still have movement visible, so people aren't quite sure whether or not you've had a treatment or not. Leave people guessing. A frozen appearance means you have no movement to show, you can't express anything, and it's very obvious that you've had work done. So if Tom was to have a small dose across his forehead, along his smile lines and his frown, it would be so that you wouldn't really tell he's had it done. But over time, the movement reduction would help soften these static lines. So microneedling would consist of a skin pen or an M pen that runs across your skin, and it causes tiny micro injuries, which helps to create more collagen and fibroblasts due to the trauma. The other option is PRP, which is your own blood and plasma and platelets taken from your blood and injected back into your face. And what that does is the stem cells create a healing process and improve your collagen, make your skin look plumper and firmer, and therefore reduce the static lines.